You need to watch this video to the end. It could be the reason you save yourself or a loved one from a sudden heart attack. I am a cardiologist. Every day, patients come to see me not only with worries about their heart, but also with another very real fear: medical costs. They show me bills, insurance statements, and after many years, I've noticed an average number that repeats over and over. For a patient who is at high risk for heart disease, but not yet at the point of needing surgery, that number is around $6,700 a year. You might ask, where does this number come from? It's not from one major surgery. It's a slow death by 1,000 small cuts that you have to pay monthly. First and largest is the cost of medication. The copay for prescription drugs like new generation statins, blood thinners, and various blood pressure medications can easily reach $200–300 a month. Just multiply that and you get around $3,000 a year. Next is the cost of follow-up visits. Every 3 to 4 months, you visit a specialist, and each time costs a fee. This adds up to about $400 a year. Then there's the cost of tests: echocardiograms, stress tests, in-depth blood work. These things are necessary, but they also add about $1,500 to $2,000 a year to your bill. And finally, there are the hidden costs that few people notice. A trip to the emergency room for a sudden chest pain, even if it's later determined to be nothing serious. Or simply your annual health insurance premium skyrockets because you're classified as high risk. We can add at least another $1,000 a year for these items. Add it all up, and you get the number $6,700. A huge financial burden just to maintain a health condition that could have been improved. But here's the good news: many of my patients have managed to cut a large portion of this bill. And in today's video, I will reveal exactly 6 ways that we accomplish that together. So where do we start to break this cycle? The first way isn't a pill or a diet, but knowledge. It's about you truly understanding and mastering the 3 most important vital signs. Numbers that go far beyond what you typically see on a standard lab report. First, let's talk about cholesterol. Many people only know about good and bad cholesterol, or LDL-C. But I want you to know about a more important metric that is the LDL particle number, or LDL-P. Picture this: LDL-C only tells you the total weight of cholesterol in your blood, like knowing the total weight of traffic on the road. But LDL-P tells you how many cars are on the road. It is the number of these small, dense cholesterol particles that is the real factor causing traffic jams and blockages in your arteries. Asking your doctor for a more advanced test to know this number is the first step in attacking the root of the problem. The second metric is your actual at-home blood pressure. Many of my patients experience blood pressure spikes at the clinic, a phenomenon called white coat syndrome. This can lead to overprescribing medication. My advice: invest in a good quality home blood pressure monitor. Take your reading at the same time each morning and evening after you've rested for a few minutes and record them in a logbook. These numbers provide us, the doctors, with a much more accurate picture of your condition, helping us adjust medication more effectively with the ultimate goal of reducing the dose or stopping it altogether. And the third metric, perhaps the golden marker for assessing metabolic health, is your fasting insulin level. This is something that is not always checked. A high level of insulin in the blood, even when your blood sugar is normal, is an extremely important early sign of insulin resistance. This is the path that leads to type 2 diabetes and heart disease. By keeping your insulin level low, you are turning off one of the main inflammatory switches in your body. When you master these 3 numbers, you are no longer a passive patient. You become an informed partner. Treatment becomes more precise, helping you avoid unnecessary medications and minimize the risk of complications. And fewer complications, of course, means fewer trips to the emergency room or more expensive tests. This is the foundation for starting to cut down your $6,700 bill. Once you have the right knowledge about your numbers, the next step is to directly impact them. And our most powerful weapon is diet. My second way is an eating method that I find to be the most effective and sustainable for my patients. That is the 80-20 anti-inflammatory diet. This rule is very simple. 80% of the time, focus on eating real natural and highly anti-inflammatory foods. I'm talking about a colorful plate with all kinds of vegetables, low-sugar fruits like berries, clean proteins like fish, chicken, and legumes, along with healthy fats from avocados, olive oil, and nuts. Your goal is not to be perfect, but to maintain consistency. It is these foods that will help your body reduce chronic inflammation, which is the deep root of plaque in the arteries. The remaining 20% of the time allows you to be a little flexible. A meal out with friends, a small dessert. This flexibility is the key that helps you follow this lifestyle long-term without feeling deprived. However, the most important thing in this diet isn't just what you eat, but also what you must be determined to eliminate. I call them the 3 biggest enemies of the heart. One is added sugar found in soft drinks, candy, and most types of packaged snacks. 2 is trans fats, the hidden enemy in processed foods and industrial fried foods. And 3 are refined vegetable oils like soybean oil and corn oil, which are powerful inflammatory agents. Adhering to this diet will directly impact the 3 metrics we discussed in the first way. Your LDL-P will decrease, your blood pressure will lower, and your insulin level will be controlled. When I see these clear improvements on a patient's lab results, I can confidently tell them, we can start reducing your medication dose now. Once the diet is adjusted, we need to combine it with movement. But I know what the biggest barrier my patients often face is. They say, "Doctor, I'm too busy, I don't have time for an hour at the gym every day." I completely understand that. That's why my third way doesn't require that. I call it movement snacking. This concept is very simple. Instead of trying to do one long and tiring workout, you do many movement snacks throughout the day. These are just short bursts of movement lasting 5 to 10 minutes, but repeated regularly. What are some examples, very practical ones? You can take a brisk 10-minute walk right after lunch. Choose to take the stairs instead of the elevator whenever possible. If you work in an office, set an alarm, and every hour stand up and do 20 squats right at your spot. Or simply walk for 5 minutes around the parking lot before entering the office and after leaving work. These small actions add up to create a huge impact. Scientifically, these short bursts of movement have been proven to be extremely effective at improving the body's insulin sensitivity right after a meal, helping to control blood pressure and reduce stress hormones. Because they are so easy to do, you will find them much easier to maintain than forcing yourself to go to the gym. And of course, it also helps you save money. Regular movement, even in short bursts, also contributes directly to improving your health metrics. It is an important factor that helps your doctor reduce the dose of your blood pressure and blood sugar control medications and continues to cut unnecessary costs from your annual bill. We've talked about diet and exercise, but there are 2 other silent factors that can sabotage all your efforts if they are ignored. That is why my 4th way focuses on something I call optimizing the sleep-stress axis. Let's start with sleep. I want you to see sleep not as a luxury, but as a mandatory medical requirement, just like taking medicine. When you don't get enough sleep, typically less than 7 hours a night, your body produces more cortisol and other stress hormones. This directly increases your blood pressure and the level of inflammation in your body. Therefore, prioritize sleep. Try to create a sleeping space that is very dark, cool, and quiet. And an extremely important tip, stay away from phone or TV screens for at least 1 hour before going to bed. Hand in hand with sleep is stress management. Chronic stress puts your body in a constant fight or flight state, a condition that causes serious wear and tear and damage to the heart and blood vessels. You cannot completely eliminate stress from life, but you need to have tools to proactively release it. I often advise my patients to set aside just 5 to 10 minutes each day to practice. You can use guided meditation apps like Calm or Headspace, or simply sit still and focus on deep breathing. Inhale for 4 seconds, hold for 4 seconds, and exhale slowly for 6 seconds. Just a few minutes of this is enough to reset your nervous system. Getting enough sleep and managing stress well helps to naturally lower your blood pressure. For many of my patients who are on low-dose blood pressure medication, improving these two factors alone can help them reduce the dose or even stop the medication completely, of course under the close supervision of a doctor. This not only helps you save money on medication each month, but also significantly reduces the risk of sudden cardiovascular events, which are the most costly things on your medical bill. The first 4 ways are changes in your lifestyle. This 5th way, however, is a specific action, a turning point in the relationship between you and your doctor. I call it the frank discussion about de-prescribing. What is de-prescribing? It is a carefully medically supervised process to reduce the dose or completely stop medications that are no longer truly necessary or that can be safely replaced thanks to the successes you have achieved in changing your lifestyle. Many patients feel hesitant to bring this up, but you absolutely have that right. At your next follow-up visit, after you have shown your doctor the positive results from applying the ways above, be bold and ask, "Doctor, I see that my blood pressure and cholesterol numbers have improved significantly. Based on these results, could we review my current prescriptions together and make a plan to reduce the dose of some of them?" A question like that will show your doctor that you are a proactive, responsible patient who truly cares about your health. It turns the one-way doctor talks, patient listens relationship into a true partnership. And as a doctor, I can say that we always appreciate patients like that. And now we come to the final way. This is a rather sensitive topic, so I want to be clear from the start. This way is not meant to replace medicine, but to support your body in functioning optimally. That is, smart, not blind supplementation. When it comes to vitamins and supplements, many people make the mistake of buying a general multivitamin and hoping it will solve all their problems. My approach is different. Forget about those generic pills. Instead, let's focus on a few supplements with the strongest scientific evidence for supporting heart health. And the golden rule is always ask your doctor's opinion first. There are 3 supplements that I frequently discuss with my patients after we have their blood test results. First, once again, is magnesium, specifically in the form of magnesium glycinate. As mentioned, it helps to relax blood vessels and naturally lower blood pressure. Second is vitamin K2 in the MK7 form. Picture vitamin K2 as a traffic cop for calcium in your body. Its job is to direct calcium into the bones and teeth instead of letting it deposit in the artery walls and cause atherosclerosis. And third is omega-3 from high-quality fish oil. This is a very powerful anti-inflammatory agent that helps reduce blood triglycerides and protect overall cardiovascular health. But I cannot stress this enough, never buy and take these things on your own. Ask your doctor to test the levels of these substances in your body first. Supplementation is only truly necessary and safe when you know you have a deficiency. Supplementing strategically and correctly can help your health metrics improve to the point where some prescription drugs are no longer necessary. And obviously, the cost of a bottle of quality magnesium or vitamin K2 for a month can be much cheaper than the copay for a prescription you no longer need. So, we have gone through 6 ways for you to take back control of your heart health and your wallet. I want you to understand that these are not 6 separate actions from which you can pick one or two. This is a system, a comprehensive lifestyle, where each element supports and reinforces the others. When you master your numbers, eat smartly, move reasonably, prioritize sleep, and manage stress, you are creating a powerful synergistic effect. Your health metrics will naturally improve, allowing you and your doctor to have an open conversation about de-prescribing. The cost of medicine will decrease. When your overall health is better, you will face fewer sudden chest pains or trips to the emergency room, and you will also need fewer expensive diagnostic tests. That is the clearest path for you to wipe out the $6,700 annual bill. Always remember, heart health is not a destiny predetermined by genetics. For the most part, it is the result of a collection of choices you make every day starting today. If this video has brought you value, please help me spread this message to more people by hitting the like button. And I really want to know, of the 6 ways we've discussed, which one will you start applying first? Let me know in the comments below.